Hi, Winnie Anderson here with Dr. Patricia Repici. Trish is a physical therapist currently practicing in Woodbine, New Jersey, and she has been letting me grill her about all things related to physical therapy, fighting aging, getting our mobility back after 50, and so on. So, Trish, the next question I have for you is, I'm going to guess many people are probably wondering about, if I've been to I've been to doctors, I've been to specialists, I've been to other physical therapists. Nothing's happened. What is going to make someone feel confident that you're going to be able to solve their problem?
Well, actually, I do get a lot of patients who come to me as a last resort. They've been everywhere you just described, and they haven't, gotten their problem solved. They've sometimes had 1, 2, 3 courses of physical therapy, but the physical therapy did use the standardized protocols, and it didn't work the first time, it's not going to work the second time, it didn't work the third time. So I do really too understand firsthand how difficult recovery can be when it doesn't go well. I've had multiple surgeries of my own, I've had multiple injuries of my own that didn't heal like I wanted them to heal or as quickly as they should have. And at the time of several of the surgeries, I was significantly overweight, so that put another layer of difficulty into the mix. So I do understand a lot of times where people are coming from. I know how devastating the physical limitations can be from an injury on your, demands of the family and your life. I know how devastating emotionally it is on you when you don't get better and you're in pain. I especially feel for the patient in that I know how vulnerable that you feel when you have to present yourself to a stranger for treatment and go into this office and tell your story about everything that's going on and really feel like A, they don't care, or B, they're not listening, or C, they're dismissing what you're saying as being not relevant. The favorite line that I know people get that I think is just awful is, well, you're not supposed to have that, or this isn't supposed to be happening. What is supposed to be often is not what happens, and it's, it is irrelevant because it is what it is. So I will listen to everything the patient has to say. I'll value all their information. And then I take a really long time on my own to process the details, to do all the research about the options that are out there, not just the typical options, but also the atypical treatment plans that are effective for their condition. And I'll work really hard to put together a program for them that's going to work. Once I figure out what we're going to do, I then really work hard to explain to the patient, in their own terms, what is going on with their body. I explain why we're going to do things. I don't just say, here, do this, and that's that. The studies show that patients that understand the science of their pain actually may have less pain because of the understanding. And one of the big things that happens is that it helps to remove the fear that is associated with pain, because pain can make you so fearful of physical activity that you end up going way in the opposite direction from it. And I really feel that understanding is one of the biggest keys to recovery.
Yeah, I can certainly attest to that. There's something soothing internally about demystifying what I'm feeling, why I can't do something that I quote unquote should be able to, and then what I need to do to modify that.
Right, and sometimes you need to have the physical therapist explain to you when pain should be feared or observed, not feared, and when you just have to say, okay, it's going to be all right, it'll get better.
Right.
So
there's a certain level, not the old pain no gain is not true.
No.
But there is a certain level of, you know, if you haven't moved something, you're going to have to expect that it's going to be a little stiff and
Right.
uncomfortable. That's probably a better way maybe to say it. Would you
Right.
agree?
Well, and my favorite analogy is, you know, if you've ever broken a bone, like, or had your foot in a cast or your arm in a cast, and you take the cast off and you start to walk on it, it usually hurts. Does that mean you shouldn't walk on it? No. It just means it's going to hurt for a little bit.
Right.
But anyway, we work all that out. You know, the questions are answered, and nothing is dismissed as, you know, oh, that's, you
It's
know,
in your
so-
head.
Yeah, exactly.
Okay, great, thanks. So this has been Winnie Anderson with Dr. Patricia Repici, physical therapist currently practicing in Woodbine, New Jersey. And if you'd like to get more information about restoring your mobility, taking charge of your health, and physical therapy and how it can impact you and your fighting aging, you want to visit restoremobilitynow.com and get the video and other information that Trish has there for you.